So my name is Bill Neely. I'm the executive director of an organization called the San Antonio Community Resource Directory. So I want to stop for a minute, take a deep breath. We're going to shift gears a little bit. In talking about QPR, we're going to talk about R for a few minutes, which is refer. Not just, so we're going to talk about referrals to resources, not only mental health resources, but also other resources that are attributable to the social determinants of health and other just flourishing and being well. So take a little deep breath. This has been very, very heavy session. So let's, we're going to shift a little bit. I also want to make a little disclaimer that I am not a mental health expert. I'm an information expert. Nisi is a mental health expert, right? So I want to acknowledge that I'm here as a resource and a tool, but I'm an information expert, and I'm going to leave the mental health expertise to the people that have that. So I want to make that clear. Let's do this. So who knows the answers to these questions? Do you know where the food pantry is closest to your house? Do you know where the food pantry is closest to my house? Do you know how to find out? Well, so SACRD.org, by the way, is how you find out. So if you needed new glasses or dental care, would you know where to go to get that? If you needed a PTSD support group, would you know where to look? If somebody comes to you and they are trying to find a place to live that costs $1,000 a month and they have a broken lease and they need a place that's on the west side close to their mom, do you know how to find that? If you're looking for a mental health resource for your child who's become withdrawn and you have Medicaid and you live in Castle Hills, do you know where to look? Right? So SACRD is for this. This is why we built SACRD, was to answer those questions. So this is what it is. So I'm going to read the sentence. I'm going to sit here for a minute, and then I'm going to put my hands on the keyboard, and we're going to do a little searching, live demo. So let's read it. The San Antonio Community Resource Directory, SACRD.org, SACRD.org, is a free, comprehensive online directory of human service resources offered by congregations, nonprofits, government, and other compassion groups in and around San Antonio. I'm going to break that down a little bit because there's a lot of really important words in there. One is that it's free. The platform is free to use. There's no cost to come in and search and look for information. There's no cost to the people that have put their information into the directory. So to put information in and to get information out is completely 100% free. The platform is not free to operate, but it is 100% free to use and to contribute information to, okay? It's also anonymous. You don't have to tell me your email address. You don't have to tell me how much money you make. You don't have to tell me if you're employed. You don't have to tell me anything about yourself in order to use this. 100% anonymous. So we talk about comprehensive and inclusive. So comprehensive in that this is a directory of all human services. All of them. 140 categories. Everything that a human needs. Transportation, food, shelter. I need help finding work. I need mental health care. I need medical care. I need household supplies. I need pots and pans for my kitchen. All human need, okay? 140 categories, 11,000 programs that we've identified and put into this. So if you know a human and you have a need, you're going to find it on SACRD.org, okay? So comprehensive and inclusive in that it's not just a nonprofit directory. It's not just a government directory. This is every provider that's in the human service space. So nonprofits provide a lot of service. Government provides a lot of service. Faith communities in a city about the size of San Antonio probably contribute about 30% of the economic impact of human service not paid for by governments or foundations. So it's a huge component. So all providers, and even on SACRD.org, we can include small business where it makes sense to do so, particularly in the mental health and addiction and recovery spaces. There's a lot of for-profit providers in that space that should be included because they're offering a service that's necessary, often in an affordable way. And so we can include those. So it is a comprehensive directory of all human services provided by all providers throughout the community. And we serve the greater San Antonio area. So this is Bexar County plus the surrounding counties. So Bernie, New Braunfels, Seguin, Pleasanton, Divine, so you go around, and Bandera. So it goes all the way around. 2.5 million people that are in the service area that are provided here, okay? All right, any questions? The best way to understand it is to use it. So we're just going to do a quick demo, and we'll kind of go through some examples, and hopefully you'll get a feel for this. How many of you have used SACRD before? So a lot of people, right? So if you've got a thought or a question that you want to offer, just jump in when you're ready. Also, you can pick this up and use it on your mobile device. runs perfectly on a mobile device. There's no app, so you don't have to download anything. You don't have to have a credit card on file with the App Store, anything like that. You can just use SACRD, pop it open in Chrome, Safari, whatever it is you use on your mobile device, Android, iPhone, whatever, it's going to work. SACRD.org. Okay? All right, so let's jump in and do a little demo. All right, does this one work too? Can everybody hear me? Okay. So here we are at sacred.org. Is that good? Can everybody see that? So here at sacred.org, the first thing you want to do is just go to your browser, open it up, sacrd.org. It's easy to find. If you want to follow along on your mobile device, I invite you to do that. You don't have to. The first thing you always want to do is come in and put in your zip code. So everything we do on SACRD is always going to be by proximity. We want to give you something that's close by. If you're looking for a food pantry and you live by Ingram Park Mall, and I show you this great food pantry that's over by McCreeless Mall, that's probably not useful, right? So we want to get you something that's close by that you can get to easily. So start by putting in your zip code. I'm going to use 78207. This is a West Side zip code. It's just across downtown, Lanier High School, San Fernando, Cemetery, places like that. So you put in your zip code, and then you can begin searching. So we can either type right here in the search box. So maybe we're looking for a food pantry. I can go ahead and type that in, and then we get some options. Here's a list of food pantries. Here's some individual specific food pantries. These are all things that are going to be close by, okay, within a close proximity to that 78207 zip code. So I can go ahead and click the food pantry subcategory. Now we can see all the food pantries that are close by. So we're the little blue dot right here in the middle of the map. Every zip code has a geographic center. Who knew that the post office publishes such information? But here it is. And so this is the center of that zip code, and then you can click on the pins, and you can see what's going on at this particular location. So you can find something that's as close to you as you're looking for. You can also then scroll down here on the side, and you can see the list of organizations. So we can just pick one of these, and we can open it up. So this is what we call the program panel. So there's 11,000 of these that are on the site on all different types of services. There's about a dozen pieces of information that we identify for each one of these things. What's the name of the program? What's the organization that's operating it? Where is it located? How do I get in touch with them? Give me a description of the services that are going on. This one has some requirements. In this case, you have to live within a particular parish boundary. Sometimes you have to live within a zip code. Maybe you have to be a veteran. Maybe this program is gender segregated. There might be some eligibility requirements for the program. And then if there are fees, we try to disclose those as well. Most things on SACRD are free. Not everything, but almost everything. And also regarding the eligibility requirements, we don't list membership programs on SACRD. So we don't put a program on SACRD if you have to be a member of an organization. That's not something you would find on SACRD. Those are great programs, and we don't discourage them, but you won't find those on SACRD. We'll find programs that are open to the public or anyone in the public. Maybe it's a veterans program, maybe you have to be a veteran, but any veteran can come and participate in that. I think the most restrictive program we have on SACRD is a navigation or a benefits navigation service for retired federal employees. So that's probably the most restrictive program we have. Okay, and then we have some operating hours. If you're going to go in person, this is when you have to go, and then a bunch of contact information. So roughly a dozen pieces of information that we collect and list on each one of these things. Okay? All right. You can, for this particular program, St. Vincent de Paul, this is operated generally by Catholic parishes. They have this requirement that you have to live within the boundaries of the parish. So everybody knows what all the parish boundaries are, right? No? So we are able to draw those. If you have an unusual geographic boundary, then we can draw that on the map. This one is nicely rectangular. I can assure you they are not all that way, okay? But this one is easy to identify. But if you have a unique geographic boundary, we can put that on there. Most boundaries are zip codes, things like that. Occasionally you'll get parishes, maybe you'll get school zones, things like that. So we can help you with that if you have that. The site is also available completely in English and in Spanish. So natively bilingual, English-Spanish. There's a link on every page where you can switch to Spanish if you would prefer to read that. And then it's also the only site in Bexar County that I'm aware of that allows you to search using Spanish search terms. So if you put in Spanish words into the search box, you'll get appropriate results that match. Interestingly, you don't have to be reading in Spanish to be able to use the Spanish search terms. The search box will work in English or Spanish, regardless of how you're reading, okay? If you use Spanish search terms while you're viewing the English, you'll get English results, but they will be appropriate to the Spanish terms. Okay, so you can come in and you can click that. So if you want to search in Spanish, you can, if that's your preference. In addition to in-person programs, we also list virtual services. So anything you see in gray is going to be a virtual program. So these are either sometimes they're telehealth services, maybe they're hotlines that you can call. Sometimes there are other websites or other resources that might be focused on, like this one in particular of an after-school meal locator for kids. This is a national program. So in addition to the in-person programs, there's also virtual services that you'll find on SACRD when it's appropriate. Okay? All right, so we can keep searching. I mean, there's lots of stuff here. Maybe you need personal hygiene items. Maybe you need a ride to, maybe you need a bus pass, and you're looking for a way to get a bus pass so that you can get to work. Maybe you need a transportation for your grandmother to a medical appointment. There's services here that will help you pay for transit, that will come give you a ride. All of those things. You can also browse through the categories. So you can see that we've got, if you're looking for a grief support group, maybe you're looking for a fan for your house, maybe you're looking for some free Wi-Fi or a place to get a computer, maybe you're looking for a place to do your laundry, maybe you need a place that helps with home repairs. So you get the idea, right? There's a lot of programs, 140 categories, almost 11,000 programs that you're going to find here. So the next question that I get asked often is, how do I know this information is accurate? Okay, well, it's because we have a staff of people that work hard to make sure it's accurate. So we have resource investigators that we hire that are on our staff whose job it is to review this information. They find programs, they list it on SACRD, and then they come forward and update it. So you can see this particular program, we've updated it sometime within the last year. Looks like somebody needs to work on this category. Here's one that was in the last 4 months. So here's in the last 1 month. So right there on the site, we're telling you exactly when and where how recently we've updated this listing. Those updates happen because we call the phone number, we check the website, we send them an email, we reach out to them as if you would if you were trying to receive the service, so we can make sure it's up to date. Okay. So I want to show you one more great feature, and then we're going to pivot a little bit into the mental health specific resources that we offer. So, yes, question.
Sorry, just real quick. So if I wanted to call, say if I call one of these places and they were out of services, is there a way that I can call y'all or I can let y'all know so y'all can update the site?
Yeah, there is. So let's look at this one. So here's a cleanup service. There's a link right here at the bottom of every listing called Suggest and Edit. So can everybody see that? It's right there, it's on the bottom. So if you tried to use this or contact this organization and you discovered we had something wrong, maybe they're not there anymore, maybe we said they're open on Tuesday and they're not open on Tuesday anymore, things like that, then you can click this link, Suggest and Edit, and then fill out this form and you can tell us what you found. Okay, so we get 4 or 5 of these a day that come in from people like yourselves that are using SACRD to navigate people to resources. We also get these from the programs themselves. When they make a change to their program, they use this form to inform of that and tell us. We do about 1,000 updates on the site a month. So we're updating 1,000 programs every single month. Did you have a question?
Yeah, I have a question. So if someone doesn't inform you that's been updated, is there a set time that the people that update go back and look at the information, or is there like a trigger there that's already in the application, in the software there that kind of lets you know when you need to go back and look for updates?
Yes. So the question was if something changes and nobody tells us, how do we find out? So our intention is to update every program at least one time a year. And so we have some management tools and the grossness of how you run the company, right? But we have these management tools and reports that will we'll flag our resource investigators. So my resource list for this week are these 50 or 60 programs that I need to do. They're the oldest ones. We haven't talked to this person in 8 months. You need to call them and find out what's going on. So they have a targeted list of services that they go to look at each week. So, okay? And our average right now, we measure this in like 50%, 50 percentile, 90th percentile kind of programs. Our 90th percentile right now is running at about 320 days. So that means 90% of the programs have been reviewed in the last 320 days, and the midpoint 50% is running at about 130 or so right now. So, okay, so it varies, right? But we measure it, we keep up with it because it's really, really important. So in addition to being able to find the information, knowing that it's up to date, and getting the information you need, it's also really important that you get this information into the hands of the person that needs it. So once I've found something, I need to get it to you. We looked at it together, maybe on my computer in my office, maybe we were sitting next to each other and we were on my phone. Now I need to give you that information so you have it in your hands. There's a couple of ways that we've built in systems to do that. There's a share button right here on every link. So if you click that share button, you can then print this out. If you want to do a printout, you can get a nice, neatly formatted page that's easy to print, that they can take with them. You can also send a text message. That's a really popular feature. Who wants to get a text message from SACRD? You have to tell me your phone number if you want the text message. So.
I'll go 210.
Yep.
889.
889.
3262.
3262. So then you can put in the phone number, you can put in your name, and then maybe a little message. Okay? And then you click send. So now that will send a text message from a do not reply number that's owned by SACRD to that individual with a link back to this page so that they can get that. This is a great tool. Did you get a text message? Oh, she's got a check. So this is a great use of the tool if you have met somebody that you've helped and you need to send them a text or an email, but you don't want to reveal your own personal information. This is an excellent way to do that so that you can maintain boundaries. Yes, sir? No, ask as many questions as you want.
No, I just want to know, like, so say if you were offering a new service, like, how could you call and get your service added onto the same service?
Right, so you're like, hey, did you look at my presentation notes? So thank you for your question. So there's a link right here at the top called What Are We Missing? So in addition to be able to make an update on a program that's already on the site, you can do that through the Suggest and Edit button. There's also a link up here, What Are We Missing? That you can come in and you can fill out this form, tell us the name of your program, your organization, this information. We'll take this information, it goes to one of our resource investigators. They'll review it a little bit and then get it up on the site. Usually takes us a day or two. We do a little bit of verification. We don't come to your organization and look at it, we don't do an audit of your program, but we do some verification to make sure that we can tell that you're really there, right? We call the phone number, things like that, check your website, okay? So if you want to add something, you can use that What Are We Missing link. There's also the Suggest and Edit link if you want. There's also info at sacred.org. You can just email me and we'll take care of that. So who got the text message? Did it come through? Was it everything I said it would be?
It is everything. It tells me the program that you had, the Catholic Church program. It gave me a link, and that it was sent by SACRD.
That's right. So and if you are viewing the site in Spanish and you send that, all of the information from the text message is in Spanish, except unless what you typed was in English then. But it's going to be an appropriate English or Spanish thread there. Yes, ma'am.
Question. So I have some clients who speak English but don't read in English.
Mm-hmm.
And I don't speak or read in Spanish. But if I needed to send them something in Spanish, do I just...
Yeah, if you wanted to send that link in Spanish, you just switch to the Spanish view.
Okay.
And then hit the share button, and now the text message that they get is going to be into the Spanish version of the site. Mm-hmm. Okay, and all of the stock language in the text will also be in Spanish. So things like if you want to opt out, et cetera, that will be Spanish terms and things like that as well. So okay, all right. So I could keep going. I could go on and on about SACRD. So, but I want to talk a little bit about some of the specialized services that we've offered, that we've created. So, food pantry, baby supplies, kitchen items, these are not simple needs, right? But they are simpler programs to understand, right? You go to a food pantry, most of them are the same, right? I'm going to it's not hard to find one that's going to meet my needs, because they're basically all, very similar services. But in places like, in services like around mental health, some types of housing-related needs, this is not the case. These are very complex services, lots of variation, lots of variety. So we've built a way in using what we call a portal, a mental health care portal, a housing portal, et cetera, to help people navigate through these more complex scenarios to find services. So let's jump into mental health care. So we have about 2,000 mental health care programs that we've identified and are available on the site. We've built a guided interview process so you can answer a few questions about your situation, and we can help narrow that down. So we start with 2,000. We answer a couple of questions, we narrow it down, we answer a few more questions, we narrow it down even further, until you get to a short list of what's close by that can help you, right? So we're trying to take away some of that information overload. There's way too much, I don't know what to do, right? Answer just one question at a time, and we'll get you through there. So let's use a scenario. Let's talk about Carolyn. Carolyn has a son, teenage son, who's become withdrawn, is not really engaging in the activities that he used to enjoy. She's worried about him. She wants him to see somebody in person. She has Medicaid. Okay, so let's see what we can find for Carol. So we can say, guide me through this process. She lives in 78213. This is the Castle Hills area. She wants a counselor, somebody in person. She does not have a diagnosis. This looks like anxiety, depression, right? But those are clinical terms, and we don't want Carol to use those, right? We want her to describe her situation. So she can say, I don't have a diagnosis, so we can give some what are you experiencing? This one matches my need. And now we have a list of programs. The map is centered on 78213. There's still 900 programs, so that's still a lot. We can come down here further and we can narrow it by age. Show me something for youth. Show me something for payment that will take Medicaid. Now we're down to 250. So we narrowed that down in just a couple of questions, narrowed that down from this huge list into a smaller list, geographically centered with a map. This list on the side here are the 30 programs that are closest by. So now we've with very little effort, we've presented a smaller list that is targeted. So we know that everything on this list is going to be able to address a situation that looks like this one. Now, she's still going to have to talk to this organization. She's still going to have to make a phone call. Still going to have to make an arrangement for an appointment. Still going to have to verify the insurance, right? This is not done, but we're way down the path to providing a solution, okay? Or helping Carol find a solution, rather, okay? All right, any thoughts on that? Any questions? Oh, thank you. So SACRD.org is a 501c3 independent nonprofit agency. We partner with the city of San Antonio, so they have supported our work. And the site is used extensively by city employees as well as nonprofit employees, faith community employees, and individuals seeking assistance. So we get about, the site is, when I say it's used extensively, in the last 7 days, what I just did to come into the site and look for a solution, that happened 14,000 times in the last 7 days on the site, about 2,000 times a day. How many people that is, the site is used extensively by navigators, case managers, social workers, so they're using the site to help their clients, as well as individuals that are using it for themselves or their family members. So 14,000 visits to the site. We don't count the individuals exactly, but it's probably 5,000 to 6,000 people, individuals that use that. Some of them use it 1 time a week, some of them use it 3 times a week, some of them use it 3 times a day. And so it's extensive. We think that the reach is probably the number of people in our service area that have received assistance from SACRD in some way, found a program, we think is probably around 300,000 people in the last year. So the site's anonymous, so we have some estimation tools that lead us to that. But it is widely used, extensively used, the most comprehensive list of resources anywhere in Greater San Antonio. Okay, we can do another guide through the mental health program, and I just have a minute left, so we can do another guide. Maybe we have a situation where somebody has been hearing voices and is having ideations about harming themselves, and they want to talk to somebody right now, and they want to do it in Spanish, okay? Or maybe you've encountered somebody and you're trying to navigate through this process. We can come in, the zip code is less important in that scenario. I need a hotline, I need to talk to somebody right now. I can come in, I don't have a diagnosis, but I can scroll through the list here. I'm thinking about hurting myself. I'm hearing things that other people can't hear. And I want to do this in Spanish. Here are the hotlines. There's 10 of them. These are all hotlines, places I can call right now that will either talk on the phone, text, chat systems where I can get help in Spanish for this particular need, okay? So we could do this, I could do this all day. I literally do this all day, all right? But we can, so I want to go back and I want to say we have a similar tool that I don't have time to go through right now around housing. So if you're looking for a place to live, you have a housing barrier, you can use our housing finder tool. You can come in and you can answer questions about what part of town you want to live in, how much rent you can pay. I have a broken lease and a criminal record, and we'll show you the places that can accommodate that. Maybe you have a need other than finding a place to live. We have the housing services. Maybe I have been living in my grandmother's house with my kids for 2 years, and my grandmother just died, and my mom told me that my grandmother left me the house in her will, and I can live there permanently. But now I need to I want a mortgage because I need to fix the roof. You're gonna have to prove that house is yours. So you can find services that will help you with that. Maybe I'm about to be evicted and I need to know what to do. Using the housing services portal, you can find a service that will help you with that, okay? So I also want to offer you, we have right here on the front page, these SACRD training sessions. If you want to learn more about SACRD, this is the best way to do it. We offer a monthly Zoom call. Anybody can log on. It lasts about 45 minutes. It is similar to what we just went over today, but it's going to be in more depth. We'll have a little more time to spend on it. So if you want to do that, or if maybe there's somebody you know that you think should hear about this, then you can do that. We also do these sessions if you want us to come to your organization and train your staff, then we can do that. These monthly Zoom calls are used by individuals that want to learn about it, but also by organizations that are onboarding new staff. They'll send them to this training as part of their orientation with the agency. Okay, and the last thing I want to offer you is a handout. So we have these pocket cards. These are just business cards that you can you can take with you. You can hand to your clients if you want some of these. We have a table in the lobby that'll be there until about 2:30 or so. If you want to pick up some, they're there. We have some flyers and other things. If you want us to send you a couple of boxes, we'll do that. You can order. There's a link right here, that tiny.cc link. There's an order form where you can order those. We will send you as many as you will use, English or Spanish. Okay. We've done in the last 8 months, we've mailed out about 50,000 of these cards to about 300 organizations. So we distribute these to whoever will use them at their request. Okay. This is my contact information, so if you are interested in learning more about SACRD, you can call me. We do not have a case management service, okay? So we support your case management service. We don't have our own, so please don't ask your clients to call me because I can't help them, okay? I can send them to SACRD and I can help them find a case manager, but that's what they probably have asked you to do. So let me just give a disclaimer there that I'm happy to help you use SACRD, but it's not a case management service. So if you have any questions, we'll take those, and